Hello, I'm Margaret Armstrong. I'm a resident of Newcastle-under-Lyme, and I recently got involved in a campaign group, Cancer Not-for-Profits. Something that I've learned of recently that I wasn't aware of, and I don't believe a lot of people are aware of, is TTIP. I didn't know about you guys until recently, so I was really pleased that, I found it very informative and really encouraged by the work that you're doing. However, I'm very worried about how will that all work with TTIP. I don't know if you're aware of TTIP, and if you are, how do you see the work that you do being able to continue to do that good monitoring and to ensure that our services, our health services, are going to be, if you like, managed and governed by us and not by somebody else?
Sorry, up and down. You're talking about the Macmillan project on cancer and end-of-life services and the CCGs working together to come up with a prime provider on those services. Is that? Can I just clarify that?
No. Although that is what the. Can I have the microphone back? I'm sure you can hear me. That is the campaign group that I am with. Yes, but that is not my question. The question is to do with the transatlantic trade investment partnership, which is currently under discussion between the EU and America, which means that a whole host of things are, if this goes through, up for sale, if you like, which means that lots of other countries, including America, are able to come and bid and purchase, if you like, parts of our healthcare. How then do we manage that? How then can you, and so I'd like to know how the work that you do is going to be able to work with that, how you see it affecting us, and equally, are you not concerned, and do you not think that health should be removed from this trade agreement?
In that case, I'm going to hand over to Robin, because I thought you were talking about specific, but actually talking about more general issues, so I think it's right that Robin should.
I think in my opening address, I said that we're in constant change, constant turmoil, lots of things really, especially the public sector. It would be wrong for us to comment on the one hand who actually sort of provides health care. What's even more important though, going back to my speech and what we've heard this morning, is people stand up and make their comments known. And we as an organisation, we're actually funded by the system anyway, by the Department of Health, via the County Council. And we're here to capture people's views. So the issue you've just raised, I was sitting there trying to work out what it was, if I'm being honest. Now I understand what it is. That is a major issue about healthcare and provision. We're not a political organisation, but we do have a general election next year. We're not lobbying for anybody, but I can imagine that lots of people will be lobbying all over the place, and they're already doing it, as we can see in the press and the papers and all the rest of it, and all sorts of different policies and procedures. But I think what we need to be clear on is what we want to ensure is a top quality healthcare system, in our case for the residents of Staffordshire, but obviously for the residents of the whole of the UK. And I think if people have concerns about who's going to be providing their services, I mean, one of the concerns that we've been fielding is that people are going to have to travel to Stoke or Wolverhampton or Walsall or wherever for services, let alone, who's actually going to be organising those services or controlling hospitals or GPs or whatever. Some of the players you're already talking about are in the system already as players in the system. But I think we need to concentrate on the quality of healthcare. I'm not so concerned, even as chairman of healthcare, who provides my healthcare on the one hand, as long as the basic principles linked to the NHS, are abided by, but also that it's good quality and it's safe clinical care. And I think that people need to be making their comments known. I think you need to be sort of writing to your MPs and raising the issue of concern. That's what they're there for. Perhaps some of those people don't know. We've met the MPs in the House of Parliament and raised issues with them. One of the issues we raised, for instance, was the duplication of people doing the work that we do. And who has set some of these organisations up? Department of Health. So in fact, the Department of Health also set organisations up to do what we do. So we were concerned about it as well. So I think my simple response is, tell us about it. You've told us about it in this public forum. Jan can certainly then, as she mentioned earlier in her slides about communication, we can start a debate and a conversation within our communication documents. We can certainly raise it in various places as well and say it's been raised to us as a concern. What's the view of people? What's the view of decision makers? We can escalate it up to HealthWatch England. Jan and I are going to a meeting next week in Nottingham, which is HealthWatch England, which is obviously the parent body. They roam around the country in England and they have meetings. And the one next week for the Midlands area is in Nottingham, which we're going. We'll raise the issue. We can't give an opinion. We'll put our hand up and say this has been raised to us as a concern. What's happening? They're in the corridors of power. They're based in London. They're in the corridors of power. They can go and talk to people and ask people as well. And you can get a debate going. When I started my talk this morning, this is where we said your HealthWatch needs you. People have got to tell us what's driving them to distraction. It could be anything. We've heard from a colleague about mental health and the funds systems changing there. We heard from other colleagues about issues that they had got. It doesn't matter what the issue is, what you have to do is get it out into the open and we can start a debate. I think if I go back into the Stafford issue, when I first came onto the block, and I knew about the Stafford issue, but I'm not obviously from Stafford, so I didn't know all the ins and outs. One of the issues there, but some of the issues, everybody knew about it, but nobody was talking about it in the right place. And I think one of the reasons that HealthWatch has been set up is to start those debates in the right places. So you've told us, we'll certainly take it on, but if anybody else in your audience has got issues and concerns, if you don't tell us, we won't always know, because there is so much going on, so much noise in the system, you don't always know, what's the burning issue of the day. Tell us, and we'll have a look at it.
Thank you very much. Thank you.
The good news is, fresh tea and coffee's arrived, and even more biscuits. But we have one final question, so we'll have this question, hopefully try and keep the answer short for you. So, sir.